President, I rise to make a contribution to this Public Health and Wellbeing State of Emergency Extension Bill 2021, and in doing so indicate that the opposition is very unhappy with the shape of this bill, very unhappy with the government's approach to COVID-19 management under the state of emergency model. It is not necessary to use this model. The government has had plenty of time to develop a separate and structured model with proper rights and protections in place, proper arrangements in place that could have offered a way forward. And the opposition and others in the chamber indeed have offered support for such an approach. The hotel quarantine claims by the government that it could not implement hotel quarantine are simply not right. There has been plenty of time to develop legislation that would have provided specific heads of power for those hotel quarantine arrangements. And indeed, in New South Wales, a different model has operated. A much more successful model, I might add. Many more thousands of people have been managed through hotel quarantine in New South Wales than in Victoria. And now I note the fear of the hotel quarantine program in Victoria leaching out further cases, as has happened now a number of occasions, most spectacularly in the middle of last year, when ultimately the failure of hotel quarantine and the failure of the contact tracing in this state led to the deaths of 801 people who would otherwise not have died, So it is a disgraceful failure of public policy under this government, and indeed in the recent outing when the government allowed again the bugs to escape from hotel quarantine and to cause trouble in the community. And we saw the sharp 5-day lockdown. Again, in contrast in New South Wales, they have been able to manage significant outbreaks in significant areas of Metropolitan Sydney, and to do that with the Northern Beaches cluster very successfully. Not easy, of course, but requiring significant efforts of contact tracing, significant arrangements to be put in place. And that is not the case here in Victoria. The government always resorts to harsh lockdowns, harsh closures, and massive damage to business and the mental health of the community, children, the closures of schools and so forth, when alternate models are available. If the government had in place proper contact tracing arrangements, we would be able to manage these things more appropriately. If the government had in place better hotel quarantine arrangements, we would have been able to manage these arrangements more appropriately. If the government had in place a proper regime that did not require a state of emergency to be declared with the extraordinary and unmitigated powers that the government seeks under those states of emergency, unaccountable and unmitigated powers that they seek under the state of emergency, is the wrong way to go and the wrong approach. We will say, and I will see if possible with the clerks, I would appreciate the circulation of the amendments that the opposition will propose to this bill, and I will come back to those in a moment. I am thankful for the government belatedly bringing forward amendments early this morning at 10.
While the amendment be circulated, thanks.
Deputy President, that the government could have brought a different model to the chamber. The government could have brought a model that enabled it to have sufficient powers, including hotel quarantine or home quarantine arrangements that would have managed those risks in a sensible and thoughtful way. The opposition and others have offered support for that approach, but we are increasingly troubled about the reliance on open-ended or almost open-ended states of emergency as an attempt to give the Premier and his cohort even more power, more authority to make snap decisions, decisions that are not properly consulted, decisions that are not part of what you would think is the reasonable practice of government. Now, I understand the need for certain snap decisions with a virus like COVID-19, but the Premier has used that as his only tactic, and his always tactic. It is always, we will close this down, we will lock this down. There is never a thoughtful approach. And I have to say, this chamber has ordered the release of the briefings that are available with each and every health decision, each and every health order that is made. The health orders are often put up late, and we understand that there's sometimes a haste about that, but it's very difficult for businesses and for community groups to keep in touch with the arrangements that are in place, and often put up late at night for implementation over the weekend. And the 5-day lockdown recently was a case study in this, where indeed at 11:59 the rules changed, but people who had events and all sorts of things planned across the weekend were obviously scrambling to understand what the orders were, to actually see the precise words, and often what is said in the press conference is not precisely accurate and is not precisely what the legal definitions as they relate to the orders deliver. So the community want to see a more systematic process. They want to see a calmer process. They want to see a process where there's more consultation, and they want to see a transparent process. The Public Health and Wellbeing Act has at its core, in its objectives, accountability, consultation and transparency. And all of these, and proportionality, and all of these are being flouted by the government routinely. The chamber here has ordered the release of the briefings provided to the Health Minister and to the Chief Health Officer, and the Chief Health Officer has refused to provide them. The Minister has refused to provide them. The Leader of the government here has refused to provide them. At a briefing the other day, I asked the Chief Health Officer to provide these briefings. At a separate briefing, I asked him to provide the written briefings on each of his health orders. He was silent on that. I asked the Minister the same question. The Minister refused to engage properly with that question. And I can only believe that this is because the briefings are not satisfactory, or otherwise in some way they are something there that they do not want in the public domain. Now, the Premier at a press conference recently tried to say that there weren't briefings, and yet a most extraordinary set of conversations in response to Rachel Baxendale's questions last Friday. He tried to argue that the order itself was the briefing. Well, that's not right. That is not right. And it's not what his department says. For example, on a FOI on the curfew, they say they have a document, but they won't release it. This is the case where the Premier says the document doesn't exist, but his own department says it does exist, but we're not going to provide it to you anyway. So that is now at VCAT and proceeding in the way that most of these FOIs on these matters are proceeding. At the Department of Health, they have blocked the release of any and all briefings to the Minister, any and all briefings to the Chief Health Officer. Now, why on earth would you do that, given the transparency and accountability and proportionality and the consultation that is at the heart of the Public Health and Wellbeing Act in its objectives? Why would you do that, given the objectives of the Freedom of Information Act? What on earth is there in those briefings that is so secret that the government cannot provide it? And, you know, when there's a general public health order being made and promulgated by the Chief Health Officer or their delegate, it's improbable that there is highly personal information in there. It's improbable that there's commercial information. It's improbable that there's other information that needs to be kept secret. The government might try and say they're cabinet documents. Well, no, they're not cabinet documents, because the Chief Health Officer or their delegate has to make these decisions on their own, separate from cabinet. They can make these decisions quite separate from cabinet. They are not cabinet documents. They are documents that are required to exercise powers under the state of emergency and under the Public Health and Wellbeing Act. So I say those documents should be released. I say they should be in the public domain. And I say it is absolutely outrageous. It is a scandal that the government is not prepared to release these. I say that if they are locking down businesses for 5 days and community groups for 5 days and households and schools for 5 days, as they did in that recent lockdown, people are entitled to see the reasons in full in a structured, proper document. People are entitled to see why their business is closed. People are entitled to see why their children are not going to school. And it's not enough for the Premier to attend a press conference, and it's not enough where there are formal documents behind these decisions for these documents to be hidden. The process is shambolic, I have to say, and the government process is getting worse and worse as time goes on. I am thankful to the Ombudsman, the Victorian Ombudsman, for her report of December 2020. That report, I think, bells the cat on the behaviour of the government and the most extraordinary sequence of events that occurs with many of these health orders, where it is in the Premier's office and in the legal sections where many of these orders are made and decided, not in the mind of the Chief Health Officer or their delegate. And I think it is worth drawing the Chamber's attention at length to the executive summary at page 13, point 20, on the lockdown of the towers, the residents, public housing residents, for the hard lockdown in July 2020. And it's worth quoting this at some length with the indulgence of the House. During the early afternoon of the 4th of July 2020, the Deputy Cho was informed that a decision had been made to bring forward the quarantine and testing operation. She was told, although under the Act, if she's acting in that position, it's actually her decision, no one else's decision. Directions were to be made under the Public Health and Wellbeing Act and announced at a government press conference that afternoon. An interagency emergency management team meeting was convened at approximately 2:30 to plan the imminent intervention. At 22, the Deputy Cho was emailed proposed public health directions relating to the operation while travelling by car to the location of the press conference. So, I mean, this is an absolute outrage. This is a serious, experienced public health professional who is being treated like a juvenile by government boffins inside and the Premier's people who are controlling the thing from woe to go, in total opposition to the shape of the Act and the way it should be operating. At 23, it says, under the proposed direction prepared by DHHS's legal services team, nearly 3,000 public housing residents were to be immediately detained in their premises for an initial detention period of 14 days. This is an extraordinary intervention. This is draconian of the highest order. At 24, this was to be the first use of emergency detention powers to manage an outbreak of COVID-19 within the Victorian community and the first hard lockdown of a high-density residential building anywhere in Australia in response to the global pandemic. There were no Victorian or Commonwealth guidelines relating to such an intervention. The human rights implications of the decision were extraordinary and required careful consideration. Absolutely, I would say. The press conference announcing the operation was scheduled to begin in less than 15 minutes. At 26, it says the proposed directions were accompanied by a brief relating to the COVID-19 pandemic and a 15-page human rights assessment. These are the briefs that the Premier says don't exist. The Ombudsman's seen them. He's a liar. He is a liar. The latter did not meaningfully address whether any less restrictive alternatives were available in the circumstances, nor did it explain why DHHS considered it necessary to detain residents immediately and without warning. The Deputy Cho reviewed the human rights assessment and signed the proposed direction before immediately joining the press conference. She was not entirely comfortable with the process observed on the occasion. This was the shortest period she had ever been provided to consider human rights impacts of the proposed directions relating to the COVID-19 pandemic. While convinced of the need to impose additional public health restrictions at the outbreak site, she would have preferred an opportunity to consult with multicultural community leaders, as is required under the Act, and further time to discuss the available options. Later, given the opportunity to reflect on the severity of the intervention, the Deputy Cho told the investigation she was not convinced delaying the lockdown by a day would have made a hugely significant difference to containing the outbreak. That is the archetypical approach of the Andrews government to these lockdowns. It is draconian, it is rushed, it is shoddy, and it is likely illegal. Likely illegal. It's a serious pandemic, and that requires serious responses. It requires a serious adherence to the law. It requires a serious adherence to the proportionality and the key aspects of the Public Health and Wellbeing Act, under whose power these orders are being exercised. So the Deputy Cho was uncomfortable with the set of decisions. The process was clearly shambolic. The Premier says these briefings that are provided to the Deputy Cho in that case do not exist. He said that the other day in a press conference. He lied again. But let's be quite clear. Let's be absolutely clear.
Ms Shing, on a point of order.
First instance where Mr Davis made an unparliamentary comment, I didn't raise this objection. I'm going to do it now, though, and I'd seek that he withdraw that or otherwise move a substantive motion.
On the point of order.
Mr Finn, further on the point of order.
Madam Deputy President, on the point of order, the word that Mr Davis used was not unparliamentary. If he had referred to the Premier in the terms that Ms Shing apparently thinks he did, yes, it would have been unparliamentary, but he did not do that. He said he had done a particular thing, but he didn't actually call him. He didn't actually call him what he is.
Thank you. Mr Davis, I invite you to, if you'd like to withdraw, If not, we will actually consult the transcripts. So, Mr Davis.
Well, I will withdraw later if that is the decision after consulting the transcript.
Thank you, Mr Davis.
Now, let me be quite clear that the government's House amendment, I'm conscious of time, the House amendments that have been circulated today at 12 minutes past 10. And indeed, those House amendments were distributed whilst the release of the Royal Commission findings was occurring. It's hard to see that that's a coincidence and that the government didn't want to bury these. But leaving that aside, let me comment on the government's proposed House amendments. Well, why do you think it was released at 10 minutes past 12? I would say that some of these respond sensibly to the Ombudsman's approach and comments, and add an additional check and balance for those who are detained, and we would not oppose them in that context. But we don't think they go to the core of the problem with the bill. And the core of the problem of the bill is that for a further 9 months the government wants to give unbridled power to the Premier and his cohort, and they want to give enormous decision-making power without checks and proper balances. Our amendments will seek to limit this to 1 month with parliamentary approval of both houses, with proper checks and balances and proper transparency. We still, despite the Premier and his cohorts exercising these huge powers, have not seen the health orders and the health briefings that should have accompanied those. We have not seen the details on which each and every decision was made. We think we should see those, and our amendments will seek to achieve that. We will also seek to put in place other checks and balances to make sure that briefings are obtainable through this process, and that further extensions that are sought by the government will be accompanied by greater transparency measures. We think this is reasonable, we think it is sensible, and we think that it is a fair way to limit the power of the Premier and the power of the government in this circumstance. Now, I say that there is a need for sensible public health orders, but they need to be based on evidence, and they need to be demonstrated to have evidence behind them. They need to have proper proportionality at the basis of them. They need to have proper consultation behind them. Just as we heard the Deputy Chief Health Officer say that a delay of 1 day would not have caused a problem, and that consultation should have occurred with a number of those multicultural groups that were locked down in the towers without any consultation. People were out at work and came home to learn that their family had been locked down. People were visiting and were locked down in a harsh lockdown in that way. These were extraordinary decisions that were made without the proper material, and we still don't have a transparent look at the decisions that were made and why and how and the sequence. We know that the Deputy Chief Health Officer was uneasy in those. Mr Limbrick has talked at length about the need for proper checks and balances, and I know he will say more about this, and others in the chamber will say more about the advice that has come from the Ombudsman, and we are very respectful and thoughtful on those points. At the same time, we don't think that the government's House amendments go nearly far enough in checking and controlling the power of this government, the extraordinary power of this government. And, you know, the truth of the matter is still the issues are relating to the government's inability to manage hotel quarantine, and still relating to the inability of the government to undertake proper contact tracing. People ask an alternate government, well, what would you do? And I can tell you what we would do. We would have proper contact tracing in place. We would run proper hotel quarantine. And in New South Wales, they do. In New South Wales, they do. So I have to say that the example is over the border, and Queensland has even done much better on many of these points too. So it's not necessarily even a partisan thing in this position. I also want to make some comments about the Scrutiny of Acts and Regulations Committee. That committee, and I've read their note on this bill, that committee is again fallen short. It is not understood that it is dealing with a major inhibition of people's rights, a major restriction of people's freedoms, and it has been too weak and too casual in its preparedness to look at the public health orders. It's clear that they can look at the public health orders under the Subordinate Legislation Act. It's clear that they can make commentary about them, and they should. They should be looking at each and every one of them, and they should be seeking the background documents behind them. And they should be understanding whether they've been implemented in the correct way and with the right proportionality, the right transparency and the right accountability behind them. So I say again, SARC has fallen short. They fell short on the first extension of the state of emergency, terribly short, and on this occasion they have again not met the requirements that I think that the Parliament and the community would expect of them. I want to say something else too about the length of time. 9 months. Why is the Premier pushing for this 9-month extension? Why is the government not prepared to look at other options for regimes of hotel quarantine and other arrangements? We say there are other opportunities, and those opportunities should be taken. We should have a proper system in place that does not require the declaration of a state of emergency. We should have in place a proper system that has decent accountability and decent transparency at the part of it. I say that the key thing here is that the government come clean on many of these decisions. The failure of the government to understand the amount of damage it was doing with these orders, the failure of the government to understand the impact on small business, on the hospitality sector, the failure of the government to understand the impact that it has on the events sector and other key areas of the Victorian economy. We know that the central city is suffering. We know that suburban areas are suffering. We know that Victoria is uniquely amongst states seen a fall in our GDP, our GSP over this recent period. So the economic damage is huge. The government is racking up more and more debt as we go forward, and some debt is constructive, but you've got to ask whether 155 billion, which is the debt that we will have at the end of the forward estimates period, is a proportionate debt given the circumstances. I also say that when incurring debt as a response to these crises, obviously we need to support those businesses and others, and obviously we need construction and other works to go forward that are shovel ready, that are available to be put in place. But we do need to make sure that we still get value for money for those. We still need to make sure that the metrics around getting good value and getting good outcomes are not thrown away. I mean, it's also a window into corruption where these decisions are made in haste, and we saw that with the V-line decision on the COVID cleaning for V-line trains, where the cleaners were thrown sprinkles, thrown extras, as the government did not have in place proper mechanisms to check these contracts, nor did the board, nor did the PTV and the Department of Transport. And I use that as a single case study just to show and illustrate the risks that are there as we start to spend wildly and without proper checks and balances, which is what is occurring under this government. I also make the point that the government should be prepared to be more open. I say if the release of the orders was accompanied by the proximate release of the briefings and the arguments that are part of that, we would actually get better public health outcomes. Those in the public health community would be in a position to criticise and sharpen the outcomes. They would be in a position to propose alternate ways forward and alternate models. Without all of that information, it's very hard to see. I finally want to end on something, and the question today that Ms Crozier asked Ms Stitt in the chamber was an important one. Victoria has been slow in releasing and getting the vaccine rollout going. We've been slower than New South Wales, and that is a concern. Given we have weaker management of hotel quarantine and much weaker contact tracing here, the vaccine becomes actually more important in Victoria in controlling the spread of COVID-19. And yet we're about well down on New South Wales on the rollout of the COVID-19 vaccine. Well, it's not it's actually, you've got more of it, and you're not getting it out there through the public hospitals, the state hospitals. No, actually in the state public hospitals, our workers are doing it. The state workers are doing it. The freezers there. And why is it that the New South Wales government is able to roll it out more quickly than in Victoria? Why is that? Mr Lean, I am. I looked at the figures this morning. I looked at them this morning, and they are actually in Ms Crozier's question. So there you are. And Ms Stitt didn't seem to understand that she's got some responsibility as the Workplace Safety Minister. If health workers are not getting the jabs quickly enough, there is a risk to them and there is a risk to the whole community. We need to, and why can't the state get it out in the same rate as New South Wales? What is the problem here? Why can't our health minister and others get it out at the same rate? That is the question, Mr Lean, and it's not good enough. It's actually a real problem if we don't get moving with this vaccine program. Now, I want to also make some points here in the short period I have left to me about the way that this will proceed. Now, I think that the minor parties have obviously been talking to the government, and they've got some response in some of the proposed House amendments. But, you know, we say to the minor parties and to others, the crossbenchers, that indeed, the best way to get the Premier and the government into a position where they will look after the community interest is to see that the Parliament is in a position to make sure that any extensions are proportionate, to make sure any extensions are for a month only, and to make sure that there's appropriate transparency around those extensions. Now, that is the sensible way forward. That is the way that we think things should go. We don't think giving the Premier a blank cheque, giving him unbridled power till Christmas is the way to go. Unbridled power for the Premier till Christmas is the wrong way to go. It's not democratic, and it's not going to lead to the best public health results either. So I say we need proper checks and proper balances. We need to make sure that there's proper transparency in place. And at the moment, there's not. At the moment, the Premier and the government and the Labor Party as a whole is thumbing its nose at the Victorian people arrogantly.